Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NR509 iHuman Virtual Patient Encounter Practice Case and Self-Assessment. Description. Total points possible. This assignment is worth 100 points. Preparing the assignment. Follow these guidelines when completing each component of the assignment. Contact your course faculty if you have questions. Remember this, you will get 5 attempts for this week's iHuman Virtual Encounter case. For future weeks' iHuman Virtual Encounter cases, you will only get 1 attempt. Multiple practice attempts allows students the opportunity to review feedback from iHuman including documentation. Feedback is to be used to guide improvement on subsequent attempts for the practice case. It is never acceptable for students to submit feedback verbatim, or almost verbatim, and/or documentation in the air. Copying using the work of others is a violation of CU's academic integrity policy. Violations will be fully investigated by faculty and administration. General instructions. Throughout this course, you will have opportunities to engage with simulated patients using the iHuman virtual learning environment. For this assignment, you will complete the iHuman practice case and score your performance using the iHuman grading rubric. Completing the practice case and applying the grading rubric will help you learn to navigate the virtual simulation software, engage effectively and proficiently with a virtual patient, and understand grading expectations for iHuman assignments. Open and review the grading rubric for the iHuman Virtual Patient Encounter. You may choose to download or print the rubric to use as a reference during your virtual encounter. Access the iHuman practice case by clicking the link provided below. Clicking the blue bar will launch the activity in a new browser window. You do not need to complete the case in one sitting. If you leave the case and return later, the program will begin where you left off. All graded documentation, including the management plan, must be completed within the iHuman platform. Follow the iHuman documentation guide and the grading rubric as you prepare your client's IR and management plan. Include the following sections, detailed criteria listed below and in the grading rubric. Complete the following components in the iHuman Virtual Patient Encounter for the practice case for Marvin F. Webster. 1. Focused Health History. 1. Complete a focused health history. Scores are automatically calculated within the iHuman platform when the health history is submitted. 2. Focused Physical Exam. 1. Complete a focused physical exam. Scores are automatically calculated within the iHuman platform when the health history is submitted. 3. IR documentation, subjective data. Document the history of present illness, HPI, and focused review of systems, RAS. Documentation must be 1. Accurate, 2. Detailed, 3. Written using professional terminology, 4. Pertinent to the chief complaints, 5. Include subjective findings only, 4. IR documentation, objective data. Document physical exam findings. Documentation must be 1. Accurate, 2. Detailed, 3. Written using professional terminology, 4. Pertinent to the chief complaint, 5. Include objective findings only, 5. Key findings most significant active problem. Document key findings from the history and physical exam in the assessment tab of the case. 1. Identify the most significant active problem, MSAP, and the relation of other key findings to the MSAP. 6. Problem statement. Document a brief, accurate problem statement using professional language. Include the following components. 1. Name or initials, age. 2. Chief complaints. 3. Positive and negative subjective findings. 4. Positive and negative objective findings. 7. Management plan. Use the expert diagnosis provided to create a pertinent comprehensive evidence-based management plan. If a specific component of the management plan is not warranted, i.e., no referrals are appropriate for the virtual patient, document that no intervention is warranted. Include the following components. 1. Diagnostic tests. 2. Medications. Type a specific prescription for each medication, including over-the-counter medications. 3. Suggested consults referrals. 4. Client education. 5. Follow-up, including time interval and specific symptomatology to prompt a sooner return. 6. Cite at least one relevant scholarly source, and provide rationale for interventions as defined by program expectations. 7. Click Submit once the case is complete. Use this guide to download the performance overview report links to an external site. 8. Reflection. Download this worksheet links to an external site. Type your reflection responses on the worksheet and upload the worksheet including the title page to the designated drop box for the assignment in Canvas. 1. Assess your ability to gather information on your client within the iHuman virtual patient encounter. 1. Use the iHuman score sheet to review your results for the focused health history and focused physical exam. How did you perform? 2. What did you find easy or difficult about navigating through focused health history and focused physical exam sections of the case? 3. Describe 2 strategies to improve your performance in the next virtual patient encounter. 2. Assess your performance in documenting your findings on the electronic health record. 1. What did you find easy or difficult about navigating through the documentation of history and physical within the system? 2. Did you document all required components in the case? 3. Describe 2 strategies to improve your performance in the next virtual patient encounter. 3. Assess your performance in determining key findings and identifying the most significant active problem. 1. What did you find easy or difficult about navigating through the key findings and organization section of the case? 2. How did your key findings and MSAP compare with the expert's response provided? 3. Describe 1 strategy to improve your performance in the next virtual patient encounter. 4. Assess your performance in creating and documenting a problem statement within the iHuman case. 1. What did you find easy or difficult about creating the problem statement? 2. How did your problem statement compare with the expert's response provided? 3. Describe 2 strategies to improve your performance in the next virtual patient encounter. 5. Assess your performance in creating and documenting a management plan within the iHuman case. 1. What did you find easy or difficult about creating the management plan? 2. How did your management plan compare with the expert's response provided? 3. Describe 2 strategies to improve your performance in the next virtual patient encounter. Submission. Submit both the performance overview report of your best attempt and the reflection document to the Week 2 Dropbox. The performance overview report submitted to Dropbox will be graded. Thanks for watching.